Hey, let's talk about the coronavirus and the workforce and the advice of plan but don't panic. A little bit of an understatement because obviously, if you have listened to the news, been on social media, even been involved in your work environment, you know that the coronavirus is a very, very big concern. So it's easy to say don't panic, but the best advice that I can give is to make sure that you have a plan of action so that you can deal with issues related to the coronavirus, but then also just the overall health and wellness of your staff, including the flu, which is a major issue that we have going on right now. Please forgive me. Let me introduce myself. I'm Melva Tate, the owner of Tate and Associates. We're a leadership consulting firm, and we specialize in human resource management and career development. And we have the awesome, awesome opportunity to work with organizations all across the U.S., but in particular those that are right here in our footprint in Alabama. So whether that's nonprofit organizations, colleges and universities, sports teams, manufacturing facilities, franchisees, whatever that may be, we get an opportunity to work with those organizations and the people that help them move their mission forward. And that is one of the reasons why I'm doing this informational video, because I have been called from my clients asking, what should we do? I actually spent yesterday on about 2 hours yesterday working with a CEO and a CFO for a major organization with probably about 20 different locations in probably about 10 different states or even more, talking about exactly what their plan of action should be and reviewing communication tools and so on and so forth. I've also talked to some of the HR pros that are in my circle of support, and then also gleaned information from SHRM, the Society for Human Resource Management, which is the body that help advise human resource professionals like myself. And all of us are talking about how can we be more proactive than reactive in addressing the issues around the coronavirus in the workforce. Again, there's tons of information out there. Some is very accurate. As the days go by, we get more and more accurate information. Still, there's some information that's incomplete. And then, unfortunately, there's some information that's floating around that's just darn right false. So what is the major concern that we have? What is the major concern? A couple of weeks ago, the concern was not a matter of if the U.S. would be impacted by the coronavirus, but when. But when. And so if you have watched the news again, you know that the cases have grown. A couple of weeks ago, there were 80,000 cases around the world of the coronavirus. And again, that number has grown significantly. The U.S. Department of State has issued a do not travel advisory for China and a number of other areas around the world. You know, the airline industry has been hit and they have canceled flights or scaled back flights to certain areas. And if you look at what we're seeing with the coronavirus, it's very similar to what we saw with the outbreak of Ebola in 2014. So again, if your organization dealt with those issues, were impacted by the Ebola virus in 2014, then you're probably going to use some of the same strategies, processes, and procedures that you'd use during that time. So what do we know about the coronavirus? Again, I will repeat, I am not a health expert. But again, I have done some research to assist my clients in understanding what the coronavirus is and its impact on our work environment. So what we know so far is that it is an epidemic, and it has not turned into a pandemic yet, but it is slowly getting there, and that's when a disease is widespread or worldwide. We know that it's spread. It's a respiratory virus. Some of the symptoms that they have talked about include coughing and sneezing. So some of the same things we see with the common cold or the flu, the initial symptoms is someone who's coughing and sneezing. We also know that it has impacted the elderly more severely than any other age group. So oftentimes those individuals who are 60 and above, I think it's the age range that they have given, are often impacted by other medical issues. Again, from the information that I've read, it starts out and make you feel like a common cold. And our biggest concern is there's no vaccine for this. There's no vaccine, and the information that's being shared is that we are a year and a half out from really having a true vaccine to deal with the novel coronavirus. So some of the symptoms, some people are experiencing very mild symptoms, again, that may mimic the flu, may mimic a common cold. Some people have moderate symptoms with some body aches, diarrhea that may mimic the flu. And then again, the report is that some of the more severe cases that require individuals to be hospitalized are more like pneumonia, where again, the individual has trouble breathing, fluid buildup, and everything else. Again, I'm not a medical expert, just wanted to give a brief overview of what they have considered symptoms for the coronavirus. So some of the tips and plans, what should you do? What should all of us be doing to make sure that we're aware of what it is and making sure that we can protect ourselves and others while we deal with this epidemic? So some of the same things that we've done in the past where we try to address workforce and our workplace wellness are what we would consider very common things, like encouraging everyone to wash their hands. Any expert that you hear, you will hear them say over and over and over and over and over again, wash your hands. Cover your mouth. If you have to cough, cough in your elbow. Avoid shaking hands. So it's probably a good time to do a wave or the Wakanda hello, crossing your arms, whatever that may be. Using hand sanitizer. If you can't wash your hands, keeping hand sanitizer around. My advice is in every office, there should be some hand sanitizer as well as a couple of cans of Lysol so that you're continuously spraying things down. Again, if you have a cleaning crew, they may need to up their level of cleaning. If they're only cleaning the office space 3 times a week, they may need to be cleaning it daily based on the amount of traffic that is coming in and out, particularly if it's traffic from the outside and not necessarily the normal staff. But cans of Lysol and hand sanitizer, Clorox wipes in all of the common areas like the conference room and boardroom, restroom, break room, all of those areas you should have extra protection there. And enforcing common workplace etiquette and wellness, meaning that you stay home if you are ill. Stay home if you're ill. There was a recent survey that showed that 90% of employees go to work when they don't feel well. 90%. 90% will show up if they don't feel well. Encouraging employees to stay home is one of the best things that you can do if you are trying to prevent the spread of not just the coronavirus, but also common cold and the flu. I'd also suggest having flash meetings to communicate what your plans and policies and procedures are around infectious diseases. Review or create some telework options if you're allowing people to be able to work from home. Create some distance for your travelers. If you have employees who are traveling for business or pleasure, making them do a self-quarantine just to make sure that they are not ill and bringing anything into the work environment. Again, some of the stories that we are hearing now is that the individual picks up the virus from somewhere else. They're not showing any signs and symptoms for a number of days, and by that time, they've already spread it to their family and close circle of support. So all of those things should be taken into consideration. Also, you may want to consider, what is your crisis plan for work disruptions? Depending on the industry that you're in, it may be a slowing of your industry, or it may require you to shut things down, like some of the schools and universities that I work with as well. One other thing to keep in mind, And this falls under ADA and also under Title VII of the Civil Rights Act. We've already seen people being discriminated against based on their ethnicity or race. Again, this originated in China. So there have been reports of people making very insensitive comments and even physically assaulting someone who is suspected of having the coronavirus or being a carrier simply because of the way that they look. And making sure that you notify your employees up front that we're not going to discriminate against anyone. And certainly for your practices, if you have people in your work environment of different ethnicities and races, making sure that you're not treating one group differently than you would treat another group. So making sure that that information is stated up front and reiterating your workplace policies and procedures, including any discriminatory policies that you may have, and the EEO policies as well. The other piece of advice that I can give, and the most important piece, again, I am not a health expert. We are listening to them and taking in information every day and trying to make sure that organizations are prepared and, again, not panicking, but have a plan of action, is to go to the CDC website, cdc.gov. They're updating information 3 or 4 times a day on what we need to do, not only as a society, but work environments as well. And then, of course, if you're in HR or a member of SHRM, the Society of Human Resource Management, SHRM has a lot of great resources on their website as well. Again, everybody has stress. We don't need to panic, but we certainly need to be prepared. I'd love to address any questions or comments that you have and connect with me. Y'all be blessed.